Hi, I'm Gaia Georgopoulos. I'm an associate professor of orthopedic surgery at the University of Colorado and Children's Hospital Colorado. I'm here to tell you about a recent exciting project my team and I have been working on. We noticed an increase in the number and severity of trampoline fractures at our institution, and this stimulated us to look into national trends of trampoline fractures. We used the National Electronic Injury Surveillance System, or the NEISS, operated by the U.S. Consumer Product Safety Commission. We queried the NEISS for fractures in children aged 0 to 17 years old who presented to the emergency department between 2008 and 2017. We then isolated the trampoline-related fractures. Our results were pretty interesting. We found the incidence of pediatric trampoline fractures increased by an annual average of 3.85%. One of the most intriguing findings in our study was that pediatric trampoline fractures were increasingly likely to occur at a place of organized recreation or sport. We found the odds of pediatric trampoline fracture occurring at a place of recreation or sport to increase by an average of 32% per year. This was concerning to us. Initially, we were skeptical, acknowledging that this could be due to changes in coding practices or increased recognition of sports-related injuries. To test this assumption, we compared all fractures to trampoline fractures. We looked at whether fractures that occurred at a place of recreation or sport were more likely to happen among trampoline fractures versus all fractures. As you can see on the bottom blue line, the occurrence of a fracture at a place of recreation or sport increased among trampoline fractures. However, the same trend was not present among all fractures on that top black line. Therefore, change in locale of injury seemed to be unique to trampoline fractures. Trampoline fractures remain a common source of orthopedic injuries and a significant public health issue. In 2014, Loader et al. Estimated trampoline-related injuries to cost in excess of $1 billion from 2002 to 2011. We can see through this abbreviated history of trampoline injuries that advocacy programs initiated by the American Academy of Pediatrics and the American Academy of Orthopedic Surgeons seem to have influenced national trampoline injury rates. This was encouraging for us as it suggests a public response to these statements. Again, our study identified an important shift in the locale of trampoline fractures, with these fractures becoming increasingly more likely to occur at a place of recreation or sport. Interestingly, this observation coincides with an increase in the popularity of trampoline parks. A 2016 report by Kazmaier et al. Discovered a nearly 12-fold increase in trampoline park injuries in the United States between 2010 and 2014. Further research is needed to understand the factors driving the recent surge in trampoline-related fracture incidents and shifting trends in the locale of fractures. Advocacy campaigns have historically focused on trampoline injuries in the home, and our data suggests future advocacy campaigns should also focus on injuries that occur outside the home. I'd like to acknowledge my research team at Children's Hospital Colorado for their work on this project. Thank you for listening.